Many studies have shown the health risks for loneliness and how it's been classified as an epidemic. But we do want to distinguish because there is a difference, right, between loneliness and solitude.
Yeah, solitude can actually have positive health benefits. So 9 News medical expert Dr. Payal Kohli joins us now to talk through the differences. Now, explain the differences, because we need to establish that there is a difference.
Yes, just as you ladies said, when we're lonely, it's actually the equivalent of smoking 15 cigarettes a day.
Oh my God.
When we're solitude, it's something we want to nurture. That's a skill we actually want to build and learn how to get comfortable with because it's positive for us. So loneliness is an emotional state. It's a feeling of disconnectedness. So think about this. You could be married, you could be surrounded by people all day long, and you could still have that sense of loneliness because you're not connected to other people. Being alone, on the other hand, is just me time. It's time when you're physically alone, and it's usually positive. It can be neutral as well, but it allows you time to sort of reflect, to think about yourself. It actually makes you more creative. It makes you a little bit healthier because you get that little bit of time to reset your brain.
It makes you healthier. I'm going to use that with my husband next time because I'm always like, I just need an hour by myself. I love you. I love my babies, but I need me time. But there really is, I don't know if it's negative connotations, but just kind of this fear surrounding being alone.
No, very much so. And it's a huge stigma, in fact, in our society. And that's why this kind of conversation sort of helps to reset that. But if you think about it culturally, we're expected to be with someone else all the time. We think less of ourselves. Our self-identity, our self-worth is tied up into who we're spending time with. If we're alone on a Saturday night, we feel bad. If we're not married when we're supposed to be, we feel bad. So there's definitely those cultural pressures, but people also feel more vulnerable when they're alone because you're like, oh my gosh, what if I got sick? What if I needed something? What if something happened to me and somebody wasn't there? So it's really time to sort of reset that thinking, because just like Alex said, every single one of us needs that me time. Now, I would tell Ryan, your husband, that it's 15 minutes, not an hour.
Oh, wait a minute. Well, you were supposed to be on my side. Wait.
So at least 15 minutes. So obviously, the more time we have to ourselves, the more we can sort of reset. But we want to try to carve out at least 15 minutes of what we call solitude. Let's not call it alone time because that makes it feel negative.
I like that. I think it's important to establish, a good wording around it. What can that 15 minutes look like? Is there something that we should be doing during that 15 minutes?
Yes. So you kind of want to think a little bit about what sort of recharges you and what makes you feel a little bit better. And 15 is the bare minimum. Now, for every person, it's going to actually look different. And there's been research studies that looked at how much alone time translates into loneliness. And for most people, it's actually 75% or more. So you have to be alone 75% or more of the time to start to feel lonely because you're alone. For older adults, it can be a little bit less. But that 15 minutes should be time where you reset yourself mentally. So you think about what sort of energizes you. It should be time where you do something creative. It should be time where you're indulging in activities that culturally people have always thought about should be done in a group, like going for a walk, going to the movies, spending time in a park outdoors. You don't have to do that with someone else. You want to do it by yourself. So you start to redefine that conversation around what it means to spend time with yourself.
And so those are the same things that you would mention for, I think about some of our viewers who are empty nesters and their kids have gone off to college and that sort of thing. Those are the same types of activities you would tell them to do when they start to feel alone.
I certainly would. And I would say it's really important for every single one of us to get attuned to our loneliness sensors, because that's something we don't often think about. How do I know that I'm lonely? And it's very much like a little bit like hunger or a thirst. You kind of know when you're hungry or thirsty. So when you start to feel that disconnectedness, I want you to do two things. One, start to make a real positive vibe around those activities by yourself and do more of those so you don't feel like you have to be with somebody else. And second, even when you're alone, you can feel connected to other people, because that is something that's all in your head, how connected you feel to other people. So sending somebody an email, sending them a note, sending them a text, you don't have to physically be spending time with someone to feel like you're connected with your friends or your family members. So we really want to rewire our thinking around loneliness and what it means to spend time with ourselves.
And I think it all goes back to that quote, you can't fill up anybody else's cup if your own cup is empty. So it's really just doing it for yourself so that you can be there for other people.
Very much so. And just being really positive about it. And just shutting out everyone who says, oh, you have to be doing this, you have to be going out, you have to be, doing X types of activities. So social interaction, very important to keep us healthy and to keep away the dementia. But let's not confuse alone time with being lonely.
Yeah, good advice. Yeah. Good conversation. We got to talk, though, after the show.
So we'll tell Ryan an hour?
An hour.
Okay.
He's going to be watching this, but that's fine. That's all right. Dr. Kohli, thank you as always. We'll see.